And knock knock. Hi. I'm Anna. I'm a nurse here, and this is Tatum and Nora, and we'll be taking care of you.
Hi.
Who do we have with you today?
Hi, I'm Joe's friend. I'm his roommate, Billy Joe.
Yeah.
Yeah, I was with him when the shark attack happened.
Okay, gotcha. Okay, so we'll be doing kind of a basic assessment. Joe, just listening to your heart and your lungs, okay?
Okay.
Okay, I'm gonna ask you some. Sorry, I'm gonna ask you some questions, and they may sound silly, okay?
Okay.
Okay. Do you know where you are today?
I'm at the hospital.
You're at the hospital. Can you tell me your name and date of birth?
Yeah. Joe Beardman. June 10th, 1983.
Okay. Do you know why you're here today?
Oh, my shark bite.
Okay. And one last question. Do you know what the month is?
March.
March. Okay. All right, Joe, she's gonna ask you some more questions. I'm gonna listen to your heart and your lungs and get some vitals on you, okay?
Okay.
Okay.
Okay, Joe, how's your pain level today from 0 to 10? 0 being no pain, 10 being the worst pain.
52.
Oh, it's like a 10.
To 10? Where's the pain located?
124.
Oh, where I got bit.
Okay.
It's in his right leg.
His right leg.
Yeah, his leg's really hurting today.
Okay. Is it radiating anywhere, Joe?
102.2.
Yeah.
Okay.
Where is it radiating to?
All the way up and down my leg.
Oh, wow. Okay.
Yeah, into my stomach.
Under your stomach.
I just really don't feel good.
Are you nauseous at all?
Oh, little.
A little bit.
Joe, it looks like you're running kind of a fever.
Yeah, he's warm.
You're warm? Yeah. Your skin feels really warm.
Yeah, it's gotten worse since this morning.
Does he have anything?
Okay.
Chart?
Well, I'll just get that back up.
No, I don't see any orders to help with the nausea. That's something that we could probably call the doctor and get.
Yeah.
Okay. All right, I'm just going to assess your wound. I will
Oh, okay.
Joe, would you like some fresh ice water?
Yes, please.
Okay, I'll be right back.
Excuse me.
So I'm just gonna move out of your way. Well, I guess you're gonna move out of my way. Sorry.
I'll just get out of your way.
And how is his IV looking?
So his IV is looking good. There's no redness or anything. Do you feel any tenderness or anything with your IV?
No.
No. Okay. All right. Are you having any sputum? Are you coughing at all?
No.
No. Okay, I'm gonna listen again onto this side. I'm gonna reach over you.
I'm gonna have a gnarly scar.
Yeah, you'll have a cool story to tell with it too.
Yeah, we sure got away from that shark.
Yeah, we did. We did, Joe. We'll be riding waves in no time, man.
Okay, we'll get you all covered up here.
So how do lungs sound?
Lung sound, there's a little bit of wheezes in the bases. His heart rate is going pretty fast there.
Is everything going to be okay?
Yeah, we're gonna do our best and get him back on the wave soon enough.
Okay.
He has normal saline running at 125, and there's no signs of redness, anything. Do you have any pain or tenderness in your IV?
No, just my leg.
Okay, just your leg. All right. Hey, Nora, do you want to call the provider about the patient's vitals?
Yeah, I think that's a good idea. I was
Okay.
also looking at their labs, and his white blood cell count is also really elevated.
Gotcha. Okay.
No, is there something wrong with me?
It looks like you kind of have a fever. You might have some sort of infection from your...
Hi, doctor.
Your
This is Nora
snake
calling from
bite.
the
A
PC
snake
medical
bite.
floor.
something that you.
Yeah, so I'm calling about Joe Beardman, date of birth 6/10/1983, who was admitted a couple days ago for a shark bite, and he went to surgery for the wound. So I'm calling about his vital signs. His vital signs are currently heart rate 124, blood pressure 90/52, respirations 26, and temperature 102.2 Fahrenheit. And he's complaining of 10 out of 10 pain in his leg, radiating to his abdomen. And I was also looking at his labs, and his white blood cell count is elevated at 13,000. His lung sounds are a little wheezy in the bases. Heart rate is clear auscultation. Do you want to come down and take a look at the wound? We're thinking possible infection. See what you wanted to do about that. Okay, thanks. See you soon. So doctor's gonna be in just a second, and we'll take a look at the dressing.
Perfect.
Hi, I'm Dr. Van Winkle. I'm going to take a look at your wound, okay? I heard you got bit by a shark.
Oh, I feel horrible.
Yeah. Go ahead and take a look. Oh, yeah. Looks like you have some hemorrhagic lesions here.
Oh, dude, that looks nasty.
No.
So it looks infected, so we're going to go ahead and take a swab of it and send it down to the lab to see what's going on in there.
Oh, am I gonna lose my leg?
You'll be okay.
Oh man, he can't lose his leg. We got more waves to ride.
Be okay. Looks like it's just an infection.
How did it get so bad?
All right.
Probably from the seawater, from when you were surfing. A lot of things live in the seawater.
Oh, what are you gonna do?
Nora, do you want to call the lab for
For the results?
results?
Yeah, that lab should be back now. Hi, this is Nora up on the PC medical floor. I'm calling for the results from the specimen that we just sent down from Joe Beardman in room 6. They're back? Okay. Okay. Alright, I'll let the doctor know. So results came back. There is Vibrio vulnificus present in the wound.
All right. So Vibrio vulnificus is an organism. You probably got it from having an open wound in seawater. And we are going to go ahead and work with pharmacy. We're going to treat it with an antibiotic, and we're going to see what is the best course of action to go from here out. All right.
Oh, I hope you can save my leg.
Yeah, we'll go talk to pharmacy. Thanks.
Hi there, my name is Montana. I'm going to be the nurse taking over.
Hi, and I'm Jessica, and I'll be a nurse here too, taking care of you.
Can you tell me your name and date of birth?
Yeah, it's Joe Beardman. And it's June 10th, 1983.
Awesome. And you are, sir?
I'm Billy Joe. I'm Joe's roommate and friend. I was with them during the shark attack.
Pleasure to meet you. All right. So, Joe, what we have going on here is you have an infection in that wound that's been cultivated, and we're going to get you started on some antibiotics. Jess, actually, would you call pharmacy and see if they're available?
Sure. Hi, can I be transferred to pharmacy, please? Hi, can you please bring up the medication for room 6, Joe Beardman? Thank you.
Knock knock. Hi, my name's Isaac from pharmacy. I have some meds for you.
Okay.
All right, so the first one is ceftazimine.
Okay.
So I have 2 grams for you to give, and it's IV, and it should go in over an hour.
Okay.
So watch for signs and symptoms of allergic reaction and bloody stool, especially from this one.
Okay.
And then I also have doxycycline, which is 100 milligrams oral, and you also look for signs and symptoms of allergic reaction, and then just educate the patient on sun sensitivities when he goes home.
Okay. All right. Thank you. Joe. We've got 2 antibiotics here for you. One is cefotaxime, the other one's doxycycline. The cefotaxime, they're both antibiotics. It's to help kill the bacteria. It may make you a little bit nauseous and you may have some diarrhea, but we'll be monitoring you closely.
Okay.
Yeah, and it's also really important that you take this, you finish all your medications so that the infection doesn't come back. Okay?
I don't want to lose my leg.
Right, we don't want you to lose your leg either, okay?
All right, Joe, so I'm going to be setting up your IV tubing here for your antibiotic. Just give me a few seconds here to get everything ready.
Is it gonna hurt?
It shouldn't. Actually, if it does start to hurt, let us know. There might be a little bit of discomfort just at the IV site because antibiotics are a little bit rough on the veins and the vessels.
Okay.
Do you have any other questions or concerns about the medication?
How fast until it starts working?
Yeah, that's actually a nice thing about these water bacteria is they're very susceptible to antibiotics, so should be feeling much better very quickly.
Well, thank you.
You're very welcome. All right. And Jessica, all these meds have been scanned in?
Yes.
Perfect. Lastly, I'm just scrubbing these hubs up here, make sure that there's not a chance that we're going to get another infection.
Oh, that would be bad.
It would be.
Oh, my leg hurts so bad.
I'm sorry to hear that. I can only imagine.
We're here to do everything we can to make you feel better.
Oh, thank you, nurse.
All right, we adjusted the rate. It's going to be just a little bit slower. We should start feeling better in no time.
Okay. Oops. Okay, Joe, so you've been prescribed cefotaxime and then doxycycline. The cefotaxime is running right now, and the doxycycline is by mouth. It's 100 milligrams. You're going to be taking it twice a day. You may experience some nausea, diarrhea, but we'll be monitoring you closely. When you go home, it's really important that you stay out of direct sunlight and that you finish all your antibiotics so that the infection doesn't come back.
Okay.
Do you have any questions or concerns?
Oh, I just hope it works.
We're going to do everything we can to make sure that we get this infection gone.
All right.
All right, Joe, after that antibiotic is done running, you're scheduled to go down for an incision and some drainage. I heard that you had some pain earlier. What would you rate that at right now for me?
Oh, it's still a 10.
Okay, so we're going to get you some pain medication on board before you go down for that incision and drainage. Do you have any questions or concerns about that?
Oh, I just hope that I can get out of here soon and get back to surfing.
I think we can make that happen. We're going to do our best.
Oh, thank you.
You're welcome.
Hey man, they got those antibiotics on board now. We'll be back to riding some sick waves in no time, Joe.
Cowabunga, dude.
Yeah, dude.